This presentation is in regards to the initial consultation of new client Hannah. I will go through the initial consultation, which follows the pre-exercise screening, client screen, and practitioner notes. A brief needs analysis will be presented before detailing a plan of action for the following sessions. There are various pre-physical exam screenings available for use. I've had Hannah fill out the ESSA pre-screening tool to clear her of risk factors and the QT new client screen to establish medical history along with goals and observations. I chose not to use the following screening tools, PAR-Q and Fantastic Lifestyle Checklist, as I believe they are too brief and not specific enough for our needs. After completion of the ESSA pre-screen, Hannah scored a 0 on a risk assessment, with blood pressure being in the normal zone, therefore clearing her for participation in vigorous to high intensity aerobic exercise. While goals will be discussed shortly, during the initial consult, Hannah brought to my attention her history of non-specific lower back pain and recent time spent in hospital with a kidney infection. When questioned further about non-specific lower back pain, Hannah informed me that it had been 7 to 8 months since her last episode of pain, and that it has also almost been 5 months since she had her infection. As a precaution, fatigue levels should be monitored to prevent relapse. Health goal. Hannah has said she wants to increase her body mass from 60.4 kilos to 63 to 64 kilos. Moving forwards, it will be important to encourage the increase in body mass to not come from an increase in fat mass, but instead focus interest in increasing fat-free mass such as muscle and bone. While Hannah is within healthy levels of body fat percentage, it would be of no benefit for her following goal regarding exercise performance if her body fat levels increased. We want to encourage muscle hypertrophy, not fat gain. Hannah enjoys resistance training and is looking to improve in 3 compound lifts that she bases her training around. These are bench press, barbell deadlift, and barbell back squat. Her current 1 repetition max for each of these are 55 kilos, 90 kilos, and 80 kilos. What she'd like to increase them to, though, is a bodyweight bench press, 105 kilo deadlift, and a back squat between 95 to 100 kilos. While an increase to strength will be required, Hannah has noted that she lacks power in certain parts of the lift and reaches a moment of muscular fatigue, having to grind out the whole during her deadlift and back squat. Hannah's behavioural goal is quite simple: keep it simple. At the moment, Hannah identifies that her training is sporadic and feels that she may plateau and won't increase her totals in each of the lifts. Adherence to a well-designed program will guide her to a desirable training outcome while decreasing her chance of plateaus in strength gain. What does Hannah need to achieve her goals? Before we begin, it is our responsibility to rule out any limiting factors or contraindications due to resistance training. Due to wanting to increase lean body mass while increasing strength gains, it will be best to go with a resistance training based program. Before commencing the program, though, further pre-screening should be implemented. It is important to perform more in-depth screening to check for faulty movement patterns and imbalances as a precautionary step due to Hannah's history of non-specific lower back pain. Testing both active and passive range of motion, along with manual muscle testing, should be performed to eliminate and ensure Hannah is strong enough and moves well. Staying injury-free is also of importance, as an injury will delay reaching her goals. Managing fatigue will also decrease the chance of an injury, as fatigue increases biomechanical faults. Strengthening to prevent muscle imbalances will also lead to a decreased risk of injury as well. After screening, Hannah will need a resistance training program to follow. A mixture of hypertrophy and power training will most likely lead to best results in the achievement of her goals. As maximum strength represents the upper limit to produce force, Hannah will be required to increase her rate of force development to increase her maximal strength. The ACSM recommends for speed-specific training that the following weight sets and reps were used: 0 to 60% of 1 rep maximum for lower body and 30 to 60% of 1 rep maximum for upper body exercises. This will require 3 to 5 minutes rest between sets and the use of 1 to 6 reps. An increase in cross-sectional area, manipulated by hypertrophy of muscle fibers, has also been correlated with an increase in maximal strength along with increasing fat-free body mass. For hypertrophy training, the ACSM recommends the following weight sets and reps be used: that loads corresponding to 1 to 12 rep max be used with an emphasis on the 6 to 12 range, requiring shorter rests of around 1 to 2 minutes in between sets. Going forward, during the next session, Hannah should be taken through further pre-screening to clear of any weaknesses or muscle imbalances. Following the flow of the needs analysis, training should commence with monitoring of both her body fat levels and strength gains to begin as well, to ensure that intervention is positive.